Today I am going to talk about the maternal child health care. Importance of maternal child health. Let's see what is the importance. The first thing is reduction of maternal, prenatal, infant and childhood mortality and morbidity rate. Reduce the mortality and morbidity rate of maternal and childs. Second thing is promotion of reproductive health. Third thing is promotion of the physical and psychological development of the child and adolescents within the family. Ultimate goal is lifelong health. This is the goal of maternal child health care. First we'll see about the antenatal care. What is antenatal care? It is achieve the healthy mother and healthy baby. This care should begin soon after conception and continue throughout the pregnancy. What is the antenatal care objectives? To promote, protect and maintain the health of the mother during pregnancy. This is the first thing. Second, to detect the high risk cases and give them special attention. Third, to foresee complications and prevent them. Fourth, to remove anxiety and fear associated with delivery. Fifth, to reduce maternal and infant mortality and morbidity rate. Sixth, to teach the mother elements of child care, nutrition, personal hygiene, and environmental sanitation. Seventh, to sensitize the mother to the need for family planning, advice to medical termination of pregnancy. Eighth, to attend to the under 5 years accompanying the mother. 8 things are objectives of antenatal care. These objectives are achieved by some healthcare programs. First, the antenatal visits. The mother should attend the antenatal clinic once a month during the first 7 months, twice a month during the next month, and thereafter once a week. If everything is normal, they should go antenatal clinic. Nowadays all women are working, so minimum 3 visits is needed. The first visit at 20 weeks, second visit at 32 weeks, third visit at 36 weeks. So we should go to clinic and we should check everything is normal or not. Preventive service for mothers. It is the prenatal service. The first visit, what all we should follow? First, health history, physical examinations, laboratory examinations. Laboratory examinations, complete urine analysis, stool examination, complete blood count, HB is needed, serological examinations, blood grouping, RH type, chest x-rays, pap test, and GC culture, gonorrhea test is needed. Whether the mother is having syphilis or not, sexual transmitted disease, these things are should check. And subsequent visit, physical examination, how much weight gaining, and should see the blood pressure, pulse rate, laboratory tests, urine examination, everything. Then iron and folic acid supplementations are needed Immunization against the tetanus is needed. Group or individual instruction should give about the nutrition, should talk about the family planning. Self-care is needed. And home visiting by a female health workers. These all things are prenatal services. Before delivery, we should see these all things. What is the high risk during the pregnancy time? Elderly preemie, 30 years above means should care about them. Malpresentations, antepartum hemorrhage, threatened abortions, preeclampsia, anemia, twins baby, IUD intrauterine death, elderly grand multiparas, prolonged pregnancy 40 days after expected date of delivery, previous cesarean sections, pregnancy associated with general disease, hypertension, CKD, diabetes, tuberculosis, liver disease, so many diseases associated with their hypothyroidisms. The risk condition we should see and treat that also. Then only the mortality and morbidity rate will reduce. These all things are risk factor during the pregnancy. If it is there, we should treat very well to reduce the risk conditions. The antenatal code is important. It contains the registration number, identifying data, previous health history, and main health events. It is important for the antenatal code and postnatal code for the investigations. Next, prenatal advice. In prenatal advice, first thing is diet. A pregnancy woman consumes about 60,000 kilocalories. The lactation women needed 550 kilocalories per day. And a normal healthy woman gains about 12 kg of weight during pregnancy. During this time, the maternal stores of iron is needed. If it is less, the baby will grow with deformity. So the nutritional is very important during the pregnancy times. The prenatal advice, second thing is personal hygienes. Personal clean. Need to bath every day. To wear the clean clothes. It should explain to the pregnancy lady. The hair should also be kept clean and tidy. 8 hours sleep is needed. At least 2 hours rest after afternoon meals should be advised. Bowels. Constipation should be avoided by regular intake of green leafy vegetables, fruits, and extra fluids. Next, exercise. Mild exercise or yoga is enough. Smoking should be cut down. Alcohol should be cut down. Should not take alcohol during pregnancy times. If heavy drinks, it's produce the intrauterine growth retardations. Child may have a physical or mental health problems. Heavy drink is avoided. Alcohol is not advisable during the pregnancy time. Dental care also important, the oral hygiene. Sexual intercourse is restricted during the last trimester. During the pregnancy times, we should avoid some kind of drugs. For examples, thalidomide, hypnotic drugs, cause deformed hands and feet of the baby's born. The LSD, which is known to cause of chromosomal damage. The streptomycin drugs, which may cause the eighth nerve damage and deafness in the fetus. Iodide contain preparation drugs, which may cause congenital goiter in the fetus. Corticosteroids may impair the fetal growth. Sex hormones may produce virilisms. Tetracycline drugs may affect the growth of bones and enamel formation of teeth. Anesthetic drugs, including the pethidine, it creates delay onset of effective respiration. So during the pregnancy time, we should alert about the drugs. Again, I am telling the drug names: thalidomide drug, hypnotic drug, LSD drug, streptomycin, iodide contained drugs, corticosteroid drugs, and pethidine drugs. These kind of drugs will affect the fetus. So we should avoid this kind of drugs during the pregnancy times. Next, exposure of radiations. The positive danger to the developed fetus. The mortality rate will be there. The studies have shown that mortality rates from leukemia and other neoplasms were significantly greater among the children exposed to intrauterine X-ray. So during the pregnancy time, abdominal X-ray is avoided. It forms the congenital malformations such as microcephaly. Next, what is the warning signs during the pregnancy times? First, swelling of feet. Second, fits. Third, headache. Fourth, blurring of visions. Fifth, bleeding or discharge per vagina. Sixth, any other unusual symptoms. This all kind of signs is risk during the pregnancy. We should check why it is occurring. Should treat immediately. Next is child care. The mothercraft education consists of nutritional educations, advice on hygiene and child rearing, cooking, demonstration, family planning. Everything should teach. Learn about all those things and should prepare for all the things. This diet, personal hygiene, drugs, radiations, and warning signs, child health care, everything is included in prenatal advice. Next, we will see about the specific health protection. First, anemia. If anemia deficiency will be there, means the high incidence of premature birth will be there, postpartum hemorrhage, epidural sepsis, and thromboembolic pneumonia. This all kind of things will get mother. Iron and folic acid supplement is very essential during the pregnancy time. Others, particularly proteins, vitamins, and mineral, especially vitamin A and iodines. These also important during the pregnancy time. The presence of albumin in urine and increase the blood pressure, it indicates the toxemia of pregnancy. We should treat and prevent this. The next, tetanus toxoid injection is very must. first trimester, second trimester, and third trimester. If not put the first trimester, again the 16 to 20 weeks we can put this injection, TT injection. The second dose 20 to 24 weeks we can put this injections. Next we will see about the syphilis infections. The primary and secondary syphilis during the pregnancy times, it gives the spontaneous abortions and prenatal death and congenital syphilis. Syphilitic infection in the pregnant woman is transmissible to the fetus. Neurological damage with mental retardations. The malnutrition and the mental retardation will occur when the syphilis infection is present during the pregnancy woman. The blood test is needed when first visit. So you should check whether the pregnancy lady is having syphilis or not. If it is there, the congenital syphilis is easily preventable. The procaine penicillin injection should give 10 days. It will prevent that conditions. We should find out whether the pregnancy woman is having sexual transmitted disease of syphilis or not. If it is there, we should treat with this penicillin injections. Aware about this kind of disease. During the pregnancy time, we should see about the rubella disease also. If it is there, the fetal death will occur. The child born means the 8 year of child may get the cataract, deafness, and congenital heart disease also. So we should prevent this rubella disease also. Next, we should see the RH status. Okay, if the mother is RH negative and child is RH positive, means the immune response in her, so that she forms antibodies to RH, which can cross the placenta and produce the fetal hemolysis. When the hemolysis occurs, the fetus also death. It's called hydrops fetalis, icterus gravis neonatum, and congenital hemolytic anemia. We should see the RH status during the pregnancy times. Otherwise, it is increased mortality rate. Next, we should see about the HIV infections. The infected mother to her fetus through the placenta or infant during the delivery or by breastfeeding, it will spread the infection to the fetus. Prevent the HIV infections also. Prenatal genetic screen is important. Prenatal genetic screening includes the screening for the chromosomal abnormalities. It is the evidence of congenital structural abnormalities. Okay, if it is there, means the therapeutic abortion is available. Examples for screening for trisomy 21, Down syndromes, and severe neural tube defect, if it is there, means advisable for abortion. This anemia, nutritional deficiency, toxemia of pregnancy, tetanus, and syphilis, and rubella or H status, HIV infection, genetic screenings, this all kind of things should come under specific health protections. Next, should see about the mental preparation. The antenatal care only should go in clinic and checking BP pulse and urine examination, pelvic measurements. These are no doubt important aspect of antenatal care, but even though mental preparation is also very, very important. The family planning. If the mother has had 2 or more children, she should be motivated for sterilization. This antenatal visit, prenatal advice, specific health productions, this all kind of things, mental preparations, family plannings, this all should come under antenatal care health. Next, we talk about the intranatal care. The septicemia may result from the unskilled and septic manipulation. The tetanus neonatum from the use of unsterilized instruments. So the neatness is very important during the labor. It entails the clean hands and fingernails, a clean surface for delivery, clean cutting and care of the cord, and keeping birth canal clean by avoiding harmful practice. Hospitals and health centers should be equipped for delivery with midwifery kits, a regular supply of sterile gloves and traps, towels, and cleaning materials, soap, and antiseptic solutions, as well as equipped for sterilizing instruments and supplies. There are delivery kits available with items needed for basic hygiene for delivery at home. The aims of good internal care are through asepsis. Second thing is delivery with minimum injury to the infant and mother. Third thing is readiness to deal with complication such as the prolonged labor, antepartum hemorrhage, convulsions, malpresentations, and prolapse of the cord. Fourth thing is care of the baby at delivery, whether the resuscitations, care of the cord, and care of the eyes. We should see the danger signals during the labor. If it is the danger signal is present, seek immediate help to the transforming the mother to the nearest primary health center or hospitals. The danger signals sluggish pains or no pains after rupture of membrane. Second, good pains for 1 hour after rupture of membranes but no progress. Third, prolapse of cord or hand. Fourth, meconium stained liquor or a slow, irregular, or excessively fast fetal heart rate. Fifth, excessive bleeding during labor. Sixth, collapse during labor. Seventh, placenta not separated within half an hour after delivery. Eighth, postpartum hemorrhage or collapse. Ninth, temperature of 38 degrees Celsius during labor. This nine things are danger signals during labor. If it is there, we should seek primary health center or hospital immediately and treat it properly. Institutional care is important. The mother is allowed to rest in bed on the first day after delivery. From the next day, she is allowed to be up and about. The current practice is to discharge when the woman after 5 days, lying in a period after a normal delivery. Rooming in. Rooming in means keeping the babies gripped by the side of the mother. Mother's bed is called rooming in. Rooming in. This arrangement gives an opportunity for the mother to know her baby. Mother interested in breastfeeding usually find there is the better chance for success with rooming in. Rooming in also the fear in the mother's mind that the baby is not misplaced in the central nursery. It also builds up her self-confidence. This aseptic precautions, complications, and danger sickness all will come under the intranatal care. Next, postnatal care. Care of the mother after delivery is known as postnatal care. What is the importance of the postnatal care? To prevent the complication of the postnatal period, to provide care for the rapid restoration of the mother to optimum health, to check adequacy of breastfeeding, to provide family planning service, to provide basic health education to mother and family. Postpartial period complications is puerperal sepsis. This is the infection of the genital tract within 3 weeks after delivery. This is accompanied by rising in the temperatures, pulse rate, foul smelling in the vagina, and puerperium site, pain and tenderness in lower abdomen, etc. will be there. This puerperal sepsis can be prevented by attention to asepsis before and after delivery. The next thing is thrombophlebitis. This is the infection of veins of the legs frequently associated with the varicose veins. The leg may become tender, pale and swollen. This is the complication of postnatal period. The secondary hemorrhage, bleeding from vagina anytime from 6 hours after delivery to the end of puerperium. It means 6 weeks. It is called secondary hemorrhage. There is also complications during the postpartum period due to the retaining of the placenta and membranes in the uterus. And next is urinary tract infection and mastitis. It is extremely important to look for this complication in the postpartum period and prevent and treat them properly. Restoration of the mother to optimum health. The postnatal examination soon after delivery, the health checkup must be frequent, twice a day during the first 3 days. The female health worker should check them. Subsequently, once a day till the umbilical cord wraps off. At each of this examination, the female health works check the temperature, pulse, and respiration. Examine the breast, check progress of normal involution of uterus, and examination of the genital area for any abnormality. Check urine and bowels, and advise on perineal toilet including care of the stitches. The immediate postnatal complications, the puerperal sepsis, the thrombophlebitis, secondary hemorrhage should be kept in mind. At the end of the 6 weeks, an examination is necessary to check up involution of uterus, which should be complete by then. Further visits should be done once a month during the first 6 months and thereafter once in 2 or 3 months till the end of 1 year. In rural areas, only the limited postnatal care is possible. The effort should be made by the female health workers to give at least 3 to 6 postnatal visits. The common conditions found on the examination during the late postnatal period are subinvolution of uterus, retroverted uterus, prolapse of uterus, and cervicitis. The postnatal examination offers an opportunity to detect and correct these defects. Next, we should see anemia. The mother is anemia or not. If it is there, it should be corrected. And should see nutrition level also. If it is the mother malnutrition, the breastfeeding will come less. So should good health nutrition is needed to give good breast milk. And postnatal exercise also importance. It is necessary to bring the stretched abdominal and pelvic muscles back to normal. And psychologically, the problems is fear, which is generally born in ignorance. Fear and insecurity may be eliminated by proper prenatal instructions. It is also called postpartum psychosis. Next, we will see about the breastfeeding. Postnatal care offers an excellent opportunity to find out how the mother is getting along with her baby, particularly with regard to feeding. Breast milk provides the main sources of nourishment in the first year of life. In some societies, lactation continues to make an important contribution to the child nutrition for 18 months or longer. We'll see output of breast milk at different stages of lactations. Months of lactations 0 to 2 months per day 530 ml needed, and 3rd to 4 month 640 ml breast milk is needed. 5 to 6 months 730 ml breast milk needed. 7 to 8 months 660 ml of breast milk is needed for babies. 9 to 10 months 600 ml of breast milk is needed. And 11 to 12 months 525 ml of breast milk is needed. And next 13 to 15 months 515 ml is needed. Then next 16 to 18 months 440 ml of breast milk per day is needed. And next 19 to 24 months 400 ml of breast milk is needed, and 25 to 66 months 425 ml of breast milk is needed, and 37 to 38 months 37 to 38 months 345 ml of breast milk per day is needed. Family planning. Next, postpartum sterilization is generally recommended on the second day of after delivery. Although the lactation confers some protection against conception, it cannot be depended upon. Contraceptives have to be supplied immediately postpartum. The oral pills, combined or sequential oral pills should be avoided in a lactating mother, as they do suppress the lactations. Next is basic health education. Health education during the postnatal period should cover the following. First is hygiene, personal hygiene and environmental hygiene should be there. Next, feeding for mother and infant and pregnancy spacing and importance of health checkups and birth registration. This is the basic health education during the pregnancy periods.